Hello friends, welcome back. We continue with our lesson on the study of belladonna, and in this video lesson we shall be looking at relationships. We have seen in our earlier study of aconite how it relates to other remedies when you are managing a case. Relationships of remedies are very important because they will give you the roadmap of managing a case. We have seen in our previous lesson on aconite the different kinds of relationships. A complementary remedy is one that continues or completes the action of the drug which has acted previously. In the case of belladonna, calcarea, which is a chronic complement, and hepersulf. Follows well are those remedies which, as the name says, follows well, and they help in completing the action of the first remedy. Once again, calcarea, heper, and mercurius follow the actions of belladonna. Remember, we have mentioned previously that these remedies like aconite and belladonna are fast-acting and acute remedies. All acute illnesses are really the manifestation of a chronic underlying miasm or cause. We shall be talking more about miasms in a later module, but suffice it to note that most acute ailments are likely to reoccur unless they are addressed at the constitutional level. And that is where these classifications or relationships of follows well and complementary play a vital role. Inimical are just the opposite of follows well. In other words, they do not follow the drug chosen very well. And in this case, there are quite a few, but I'm just giving you one single example of acetic acid, which tends to aggravate unpleasant symptoms. Then we have antidotes, which simply means an antidote. But in the case of homeopathic remedies, an antidote is a dynamic antidote, which means that the action of the previous remedy, which has been selected from a list of antidotes, it will retain the good work which the previous remedy has done, and it will antidote any bad effects of the remedy. Aconite, camphor, and heper are antidotes. Remember, camphor is a universal antidote. And lastly, the relationship we have mentioned in the case of aconite, and that was the relationship of collateral remedies. Collateral remedies are something you must know because they always run parallel to the remedy which has been given previously. So you can always choose one out of these if you feel that the action of belladonna is not complete. Among these are aconite, hyoscyamus, and stramonium. We shall be studying the latter two later in the course. They are also remedies which have tremendous effect on the mind. Food and drink is also one advice you can offer so that the remedies can act better. For example, lemonade accelerates the action of belladonna. This is from the observations of Dr. Pulford. And at the same time, you should ask the patient to avoid coffee, vinegar, wine, lemon. You will notice the difference between lemon and lemonade, which is a drink prepared from lemon, but then of course you're having additives like sugar and water and other such things. And of course, vegetable acids can also be avoided so that belladonna can act completely. We had also made a mention of trios. These are remedy combinations, that means they are to be taken in a sequence, and they were used very frequently by great masters like Eugene Nash and others, including John Clark. Some of these are like formulas where you don't have to bother about thinking about a complement remedy or a follows well remedy. They are perfect examples of using relationships to our advantage. So these are like rules of the thumb. Aconite followed by belladonna followed by ferrum phos. This is a trio that comes in handy for onset of acute disease in children. Normally a child comes, say, from outside after being drenched in rain or being exposed to cold weather and develops very rapid and strong symptoms. Aconite works beautifully at the very initial stage because that's a reaction of the sympathetic system. Belladonna is the parasympathetic system remedy. So that's the next remedy that acts on, followed by ferrum phos, which improves the oxygenation of the tissues. So this is a trio that comes in very handy if you are handling acute disease in children. Similarly, we have a trio where belladonna is followed by hyoscyamus, followed by stramonium. You have heard of these last two remedies in the previous slide, and these are delirium remedies. We shall be devoting one separate module on delirium remedies. Sepia followed by bell, followed by lilium tigrum. That's another beautiful trio for downward pressure in uterus. I'm just giving this as an example so that you know that there are trios which can be used very effectively, and one of the best places to approach that literature is Nash and Clark. That brings us to the end of this presentation, and mind you, this is not a complete lesson. The rest of the research will have to be done by you. These are pointers which will encourage you to find solutions. The beauty of homeopathy is that as you keep gathering the knowledge, it has a snowball effect. You are able to add on to what you already know and what you are learning during this course. And the best way is to put it in practice and see the results for yourself. Also devote your time studying cases by masters. In this particular course, you will be shown a number of cases to teach you how homeopathy works in practice. Once again, thank you very much, and until we meet, bye-bye.